Hello， 大家好，欢迎来到纽约华人资讯网的直播现场，我是主播莉亚。近年来 EVO+ 晶体植入手术在全球范围之内引起了风潮，美国当然也不例外，它成为了最受欢迎的近视矫正手术之一。那为什么它会这么火爆呢？这是因为有许多无可替代的优势，比如说矫正范围很广，可以矫正从300到2000度的近视，还能够矫正高达400度的散光。它适合21到45岁的近视患者。EVO+ 晶体植入在植入过程中不需要去除任何角膜组织，因此也特别适合角膜偏薄的朋友。手术之后呢，视觉质量很高，夜间视力更加清晰，让很多患者都摆脱了眼镜的束缚。那么就在最近 EVO+ 的最新迭代版本 EVO+ 更是让手术效果上了一层楼，提步了患者的术后经验，那更是堪称是深度和中度近视患者的福音。今天节目呢，我们非常荣幸邀请到的是纽约 Raymond Fong Eye Care 诊所的创始人邝理中博士 Dr. Raymond Fong 来为我们详细的讲解。那 Dr. Raymond Fong 不仅是美国顶尖的眼科医生，他还是一位拥有超过35年临床经验的行业领袖。他毕业于哈佛大学，并且在康奈尔医学院完成医学学位，作为纽约地区进行激光飞秒和白内障手术最多的医生之一。他的诊所 Raymond Fong Eye Care 是美国屈光手术领域的标杆，他被誉为 Top Doctor 多年。同时他还参与了多项 FDA 的临床实验，为推动眼科技术发展做出卓越贡献。首先呢，我们有请 Dr. Fong 来跟我们打个招呼吧。Hi Dr. Fong, thank you for joining us today.
Hi Leah, thanks for letting me be on the show, and just want to say Happy Year of the Snake.
Yay, Happy New Year. Oh my God, this is so cute. This is Golden Snake. I saw all your patients are holding this, taking the picture for the good luck of this year.
That's right, for good luck, healthy and prosperous new year.
Great, thank you so much. So we talked about EVO ICL last episode, and it's amazing technology. So ICL has been already helped millions of people worldwide. Now with the EVO+, it takes a significant step forward. So please let me know what makes EVO+ better.
Forst of all, I have to say I am amazed. I've been in practice for 35 years. I am amazed by the EVO technology. The results we get in people who formerly could not have anything done is just short of amazing. In fact, it is amazing. EVO+ is the newest and best lens. It's a significant modification over the regular EVO lens. And if you look at the slide over there, it's for those diopters that are the most common, up to 14 diopters, 3 diopters of astigmatism. So that's for about 95% of the EVO candidates here. Okay. It's just a advancing technology that's just spectacular.
Great. So many people worry about like halo effect after EVO surgery and night vision. So how effective is EVO+ in addressing these concerns?
Exactly. And the reason why EVO+ came about was because exactly of those complications of glare and halo. So EVO+, has a larger surface area and negates most of the problems with glare and halo. You know, it's usually with the first 3 months you may have a little bit of glare and halo, and then it just subsides. And patients are very happy, especially for nighttime and nighttime driving.
Great. So how does the update lens to do this? I mean, how does it achieve this effect?
Okay. So I always go back to the model of eyes like a camera or eyeglasses. So if you imagine you have a very thick pair of glasses, okay, and it's a very, very small lens.
Right.
Okay, that's in a way EVO. Now if you expand it, that's EVO+. I'm exaggerating it, but essentially it's a larger surface area so that the light can't come through the edges. Okay, it's captured by the entire lens. It's a larger lens, allows more light to come in centrally, so it bypasses the side glare and halo that people get.
Got it. So as you know, a lot of Asian, Chinese Americans, they're comparing EVO surgeries like between China and the US, because China surgery obviously have its advantage, you know, but what's the main differences of doing surgery in China and US?
Okay. Well, that main difference right now, I mean, the Chinese doctors are very good at EVO. They've done probably the most in the world, but they do not have EVO+. That was only approved in the United States. So if you have it done in China, you will be getting the old EVO lens. Here in the United States, you're getting the newest, you're getting the EVO+ lens.
Got it. So unless my prescription is over -14 diopter, I will get EVO lens.
Yes.
Otherwise, I'm going to get more advanced EVO+.
Yeah, no, it's under 14 diopters, you'll be getting EVO+. Yeah, above that, you'll be getting the regular EVO lens. But most people fall within the 14 and under.
Got it. So how's in your practice? I mean, do people like complain about halo or night vision? Do they get good results from EVO surgery, like EVO+ surgery?
Yeah, again, I'm just amazed that, the recovery is so quick. The next day, they have 90-95% of the vision. And again, these are patients that in the past, we didn't have the technology to do this, and now we do. It takes a whole new level, take refractive surgery to a whole new level.
Got it. And there's more people who hesitating between the laser surgery and the EVO surgery. They probably have like mild myopia. For Chinese people, -6 or -7, and more people of these moderate myopia patients are choosing EVO. So did you observe this kind of situation?
Yeah, so basically what it comes down to is the patient's preference. Okay, in the past, we used to say only people who are very, very nearsighted, but also a lot of people coming in, they've heard about the EVO. They've heard the wonderful results. Basically, you preserve the corneal architecture. So you essentially preserve the whole structure of the eye. And they want to have EVO. And these are people who are low myopes as well. And that's fine for them. And we're more than happy to do it. I think it comes down to a matter of both choice and what the surgeon recommends, because there are other factors that come into play, okay, in terms of deciding what's best for the patient.
Got it. So how important is the precise measurements in these surgeries? I mean, EVO's lens, how do you get the correct measurements?
But essentially, I always tell the patient, look, the surgery is going to be fast, maybe 5-10 minutes for each eye, but the number of hours we spend measuring you is going to be hours and hours and hours. It has to be very, very precise. I'll give you an example. Let's say your myopia, your nearsighted is like 100 power, right?
Okay.
Let's say the laser or whatever measurements is plus or minus, 10%.
Okay.
You have 100 power myopia and you're off by 0.10. That's nothing. Essentially you don't need glasses. You're still going to be great. If you take somebody who's 1500 and you're 10% off, that's 150.
Yes.
You need glasses. So the measurements have to be very, very precise. Here in our office, what we do is we not only measure one particular data point in one way, but with multiple machines, with multiple software. So we can look at it and make sure that all these measurements coincide with each other. It is extremely important. I caution patients. We're going to take hours and hours to measure you. In addition, if you're very, very nearsighted, we have to look at the retina. So I also make sure my retinal specialist sees you as well. It's really, really belt and suspenders. We really want to be as accurate as possible. So we take our time with the measurements.
Yeah. So also there are people like asking about off-label surgery, like if my inner eye space is lower than FDA's approval rate, but actually still in the rate of the, considered as a safety. So what is your experience on that?
Well, that's why I take pleasure in looking at the results of my Chinese colleagues. So one of the major things with Chinese eyes, they're just smaller. All the compartments, all the measurements are smaller. So here in the United States, for example, the anterior chamber of the eye, okay, which is the anterior part of the eye, the FDA says 3 and above. I'll tell you, a lot of Chinese don't have that much space. But in China, okay, when they operate, they have no problems whatsoever. So based on that data and my experience, I'm able to go off-label. Now, again, I don't want to do too off-label. It's very, very small. We're not going to do it. But most Chinese fall within the 2.7, 2.8, and they do fine. The FDA, when they do the studies here in the United States, unfortunately, and I used to do FDA studies, they don't do the studies on a lot of Chinese patients. It's mostly Caucasian patients. I know that because the 10, 15 years that I was doing FDA studies, I was probably the only cohort, the only investigator that was Chinese.
So yeah, I was talking to a patient the other day. They said, okay, US FDA have a higher standard. I was like, no, actually they're not. You're just not counting in their trial. You're just not being represented in their trials.
Yeah.
It's not because they have a higher standard.
Yeah, it's the way higher is a relative term. They have very strict standards. Okay. In order to get the strict standards, though, they have to do the studies, and they're limited in the number of patients they can enroll, especially Chinese patients. They're testing on Caucasian eyes, believe me. So we know with the Chinese, the corneal diameter is smaller, the anterior chamber depth is smaller, the eyes are much more myopic. Myopia of 6 or 7, which is considered high myopia, in the general population is probably pretty much normal in the Chinese population.
Right. And you yourself actually is famous for precise measurements comparing with other Caucasian doctors. So besides for EVO ICL, let's say LASIK, especially contour LASIK is also an excellent technology, especially can help people to get more precise measurements. How does it achieve personalized vision correction care?
Right. So with LASIK now, we keep on advancing in terms of our software and hardware. The latest advancement is what's called contour, which stands for contour. So the way I explain to the patients is imagine, okay, so you have LASIK. You create a flat, and now you have the surface that you're going to laser underneath the flat. You miniaturize yourself, make yourself really, really small. Okay? You walk along that surface. When you're that small and it's that magnified, you'll see little bumps, little hills, little sloping differences that you won't see when you look at it from a small point of view.
Right.
So there's little hills and bumps. Contour takes that into account. It's actually topographic. What it does is it scans, thousands of images of these little hills and bumps, and then puts that information into the software. So when we laser it, it lasers those little hills and bumps. So it becomes very, very smooth. It takes away a lot of what's called higher order aberrations, but the quality of vision is much, much better with the contourer.
Got it. So if you give me an example, if I got, for example, -3 diopter of the nearsightedness, and maybe I was not as specific -3, but probably -3.25 or something like that. Can contour be precise like this?
Yes, it can be, but I'll also tell you, I'll be truthful, okay? I'll say for the low myopes, 3, 4, 5, you don't really need to waste your money on that advanced technology. You're going to get a wonderful, wonderful result. Okay, it's for people who are more nearsighted, especially with stigmatism. That's where the higher order aberrations come in. That's when you need more precision over there.
Got
so
it.
it's not for it can help everybody. Okay, it really helps the people who have more stigmatism, higher amount of myopia. That's where the difference lies.
Got it. So if I only have myopia but no astigmatism, which means contour may not have such difference on me.
Well, if you have like a -6 myopia, contour will make a difference. You're -2, -3, it's not going to make as much of a difference. Again, think of it like 5% of 100 is nothing. You can't even get glass for that. 5% of 600 is something. So that's where, again, the higher myopia, the more precision you get, the better it is. The percentage, even though it remains the same, the higher myopia you are, the more important that is.
Got it. So if I wanted to have a mono vision with LASIK, can I have LASIK contour on mono vision?
You can actually, again, it's not so much the monovision part that has to be more accurate, it's the level of myopia. So again, if you have low myopia, you may not need contour. If you have a high myopia, I would suggest contour. It's just a more precise way of doing the LASIK.
Well, talking about how important the precision is, so regarding the vision regression, so does higher precision in the procedure will reduce the likelihood of regression of LASIK? Because people always say, oh, I got LASIK 20 years ago, I feel I'm nearsighted again. But for your practice, actually people are not experiencing too much like that.
Well, the major problem in my office is that I tell them, come once a year for a checkup. They never show up. I haven't seen them for 20 years, so they bring their kids in. And then they say, Dr. Fong, I'm a little nearsighted again. I said, come on, let me examine you. They have cataracts. Cataract progression has nothing to do with LASIK. It has to do with the fact that you're nearsighted. And I deal with a lot of very nearsighted people. And so now they have cataracts, which is actually in a way wonderful because now we can put a forever clear vision lens, permanent clear vision lens in that corrects not only their myopia, astigmatism, but also their short-sightedness. In terms of precision and regression, it is true. There are some surgeons, who have more regression, less precision. It really depends on really two things. The experience of the surgeon and also the type of laser and hardware and software that they use. Not all lasers are the same. Some are more expensive, some are much, much more precise. In our office, what we do here is we get all the hardware and software upgrades so we're always up to date. In terms of surgeon ability and experience, so you become less precise if you take your time. But again, it's really both the software, hardware of the machine, as well as the surgeon experience.
Got it. I mean, in New York City, you can get as cheap as probably $1,500 per eye for LASIK, and people thought you just push the button to do that, so how much it would cost. But actually, surgeons' hands, they are so important of the accurately, practice the surgery, operate the surgery.
It's not a push of a button, believe me. If it was, we could have monkeys doing it. You would need a doctor. And actually, truth be told, back in New York City, it used to be $9.99. They were just competing with each other. I can tell you the lasers they used were just not the lasers you want to use on your eyes.
Got it. And now we have the clear vision guarantee for your practice as well. Tell me more about that.
So again, one of my frustrations is they don't come back. Okay. And then by the time I see them, they may have had glaucoma, they might have macular degeneration. So one of the things we do is we say, look, we'll guarantee your vision. Just come once a year for a checkup. So we're up to date on what's going on. So God forbid you don't get any of the other diseases that will be intolerable and also maybe irreversible. We want our patients to come back. We want the eyes to be healthy. That's why I've instituted this guarantee.
Okay, so for those patients who visit your practice 20 years ago, now they walk in and they have new problem, probably need the reading glasses. So what is RLE and how does it work? And what kind of options for these people?
So a lot of them, they come back in, they have cataracts, or some of them say, my presbyopia short sight has gotten a lot worse because they're older. They're in the 55, 60 years old. So essentially, again, the eye is like a camera. With cataract surgery, we take the lens inside the eye, we remove it. Now we can put a special lens in that corrects everything. RLE, fancy term, is refractive lens exchange. It's exactly the same operation. You remove the lens, you put a lens in. Both of them are once in a lifetime. The cataract, once you remove it, will never come back. That can correct everything.
So you get kind of like permanently clear vision. And it's like once a life, probably will be the last eye surgery in your lifetime to get a clear vision.
And again, it will be the once in a lifetime, but please be aware of other eye problems, glaucoma, macular degeneration, other things as well. So please just come for regular checkups. Okay.
And also just let you guys know, Dr. Fong's office provide multi-language consultations, whatever you speak, 上海话、台声话、福州话、广东话、粤语或英文, Dr. Fong's practice, and even like Spanish, your practice have like very talented staffs to help them to get correct translation and consultation. So no worries about the language barriers. Thank you so much, Dr. Fong, for joining us to talking about this important question and topic. We're going to have the next episode regarding how to control the myopia. I mean, people love this topic. They want to prevent it and then think about the solution, right?
I love that topic too. People ask me all the time.
Yes. And also, as I would say, a Harvard graduate family, Dr. Fong really have experience of, the Asian kids, how to like apply for their college and college admission rate. It's such a sensitive and interesting topic. We're going to share some insights with you guys. So stay tuned. Thank you so much, Dr. Fong. 如果大家感兴趣的话呢，都可以扫描屏幕上方的这个二维码。二维码呢，就是Raymond Fong Eye Care 邝理中眼科诊所的咨询，大家可以获得免费咨询。那大家一定要记得，如果你是60岁以上，50岁以上的话，一定要带保险哈，纽约州的保险，因为呢要去给您做全面的检查，有可能你患有这个白内障哈，所以这是需要纽约保险的。那50岁以下的朋友呢是获得免费咨询，没有保险也可以啊。然后呢邝理中眼科诊所呢是纽约最大的眼科诊所。那目前呢邝理中博士本人是做飞秒以及白内障手术 RLE 手术在纽约州最多案例的医生，所以大家不要错过这机会。同时呢 ICL 晶体您立刻享用$1500的这个折扣，希望您可以继续在节目上做停留，如果感兴趣的话可以扫码。同时呢祝贺您新年快乐。 Thank you so much, Dr. Fong. Hope you have a great year.
Hey, happy year of the snake.
Happy New Year of the Snake. Thank you. Bye-bye.
Bye-bye.